Okay, today we're going to go over the parts of a central line kit. But before we do that, let's quickly go over the process of how a central line works, how we place a central line. In order to get a central line catheter into a central vein, we follow a specific process. The first step is to actually hit this central vein with a needle. And when you're doing this, you need to be really careful because it's actually possible that you can hit the carotid artery. And it's actually possible if you advance this needle too far that you can actually hit a lung as well. But once you're pretty sure that you've hit a vein, the next step is to actually take a Seldinger wire and to advance this wire through the needle and into the vein, and then we take the needle out. Once this wire is in the vein, all we have to do is take this central lumen catheter, thread it over the top of the wire, and follow the wire all the way into the vein, and then we take the wire out. So that's basically the process by which central line placement works. Let's go over each part of the kit. The first thing that you're going to notice in this central line kit is a sterile prep sponge to clean the area off. You're also going to notice a sterile drape to drape the patient's neck with, and it also comes with some sterile gauze. When you get over to the actual kit, the first thing that I want to point out is this guide wire, or this Seldinger wire. And a couple of things that I want you to know about this wire. Number one, this right here is a 20 gauge needle. A Seldinger wire will not fit through a 20 gauge needle. You cannot use a 20 gauge needle to guide a Seldinger wire. But you can guide a Seldinger wire through a 20 gauge angiocath, okay? You can also guide a Seldinger wire through an 18 gauge needle like this. So just to review, when choosing a needle to guide the wire into the central vein, you have to either choose an 18 gauge needle, or if you choose the 20 gauge needle, you have to thread the catheter into the vein before trying to thread your wire. The next thing I want to draw your attention to in the kit is this 25 gauge needle here and this 1% lidocaine. The only use for this is if the patient is going to be awake and you need to actually numb the patient's skin prior to your central line placement. Next up, we have this 22 gauge needle right here. We refer to this as a finder needle. And the reason why we're referring to that as a finder needle is because this is the needle that we're going to initially find the central vein with. And the reason that we're using such a small needle to initially find that central vein is so that if we accidentally were to hit the carotid, we would make as little of a hole as possible. Now, it's essential to know that you're in the vein at this point before proceeding, because if you were to proceed, you could end up with a catheter like this in your carotid artery, and it could be a 8.5 French or a 9 French hole. So, knowing that, how can you tell if this blood is truly venous or not? At this point, the only way that you can tell is by the color of the blood in the syringe. Dark blood typically tells you that the blood is venous, but that is not 100% reliable all the time. The only way to know for sure whether or not you're in the vein before proceeding is to pass a 20 gauge catheter into the vein. So once we find the IJ initially with the finder needle, we would follow that with a central line catheter and float a 20 gauge catheter into the vein. Having this 20 gauge angiocath in the vein is going to allow you to verify venous blood in a couple of different ways. Number one is going to allow you to see if the blood is pulsatile or not. You just remove the occlusion there and see if blood is pulsating out or not. But then you can also use sterile non-compliant tubing, and you can hook that tubing up to the catheter and then just raise the tubing in the air. If the blood is venous, you'll see blood rise up and then eventually stop. If the blood is arterial, the blood will pulsate all the way up out the tubing. You can also hook this end of the tubing up to transducer tubing and transduce the pressure within the vein to truly make sure that it's venous or not. So just know that you must use these methods with a 20 gauge catheter to verify venous blood before threading your central line. Next up in the kit, you have a 20 gauge needle and angiocath and an 18 gauge needle. And what we use these for these are your two options you have for guiding the wire into the vein. So option number one is to advance this 20 gauge angiocath into the vein, and then you can pass your wire through that. Or you can use your 18 gauge needle and hit the vein, and then you can either advance the wire through this plunger on a Rollerson syringe, or you could just take the syringe off and advance the wire through the needle there. So let's just briefly demonstrate each of those methods. When using the 18 gauge needle method to find the central vein, the advantage to using this method is that you have a far less chance of blowing the IJ because you don't have to advance an angiocath and thread an angiocath into the vein. All you have to do is hit the vein and stop right there and then thread your Seldinger wire. The disadvantage to using the 18 gauge needle method is that now I have not verified that the blood is truly venous or not before I've threaded my wire. So, before threading your central catheter when using the 18 gauge needle method, you're going to have to actually take this 20 gauge angiocath off, and you're going to have to thread this over the wire and then verify venous blood. Through the same method here, raise the tubing up. Once I verified venous blood, then I'm going to have to reinsert the wire here and then take this catheter out. So it takes a little bit longer to verify venous blood when using the 18 gauge needle method, but at least you don't risk blowing the vein. When using the 20 gauge needle angiocath method to guide your wire, once you hit the central vein with your needle, you have to lower your angle and advance that catheter into the vein and then thread the angiocath over the needle and then remove the needle. Now the advantage to this method is that you can verify venous blood before you even thread your wire. But the disadvantage to this method is that you risk blowing the central vein. So you can choose the 18 gauge needle method or the 20 gauge angiocath method, whatever you want, but just know the advantages and disadvantages to each method. Next, we get to talk about the actual central line catheters themselves. We are going to thread these over the wire and into the vein, then we just sew it in and then we're pretty much done. But what you're going to notice when you come over here is that when trying to thread this over the wire, you're going to have a really tough time getting it past that tough skin. You're going to have a problem doing that, whether it's a central line with an introducer port like this one, but you're going to also run into the same problem if you're using a regular triple lumen central catheter. And so that is where a scalpel and a dilator come into play. So what these are here for is they're designed to lower the resistance of that tough skin and facilitate passage of the central line catheter over this wire. So how the scalpel works is we just make a small nick on the skin, kind of like so, and then we dilate that area of the skin with the dilator. So if I'm using a triple lumen central catheter, once I've made that nick with the skin, I just slide this dilator over, and now that resistance of that tough skin is lower, and I'm going to be able to guide this catheter past the skin. Now, how a dilator works if I'm going to thread a central line with an introducer port is you actually will place the dilator through that introducer port first, and then you would guide the dilator and the central line catheter all at once over the wire and into the vein. Finishing up the kit, we've got a suturing thread and needle to sew this line in once it's done. Some of these kits will come with 10 milliliters of normal saline, and that's just to maybe flush out your needles. Sometimes after multiple attempts, these needles can get skin tissue plugged in. You can flush your needles out with that saline if you need to. If you're using a central line that's got an introducer port, some of them will come with a contamination shield for a pulmonary artery catheter. And then the last thing I want to mention here is some of them will come with these clave connectors. And what we use these for is we'll put these on ports of a central line. So those are the parts of the central line kit. I hope that you check out the videos on actual central line placement, and I hope that you have a great day.